Welcome, everyone. This is the Health Equity SIG panel. Good seeing everyone here. While we're waiting for people to trickle in, I want to highlight that we currently still have open leadership positions for the 2025 to 2027 term. These are including roles of co-chair, a chair, and a student chair. So if you know someone would be a good candidate, or if you're interested in joining yourself, please use this QR code to fill in this brief form. Just need some bio and a very brief vision statement to put your name in the hat. And also, if you're not yet a SIG member, welcome. We're very happy to see you here. Please email us at this email address on the slide to join our membership list. We're just going to give another minute to make sure folks can come in before we hear from our speakers.
And yeah, I think just to introduce ourselves, my name is Kathryn Macapagal. I use she, her pronouns. I'm at Northwestern University, and I am one of the chairs of the SIG. Our co-chair, Ashley Knapp, is on parental leave right now, but she sends her regards. And I'll let Yo-Yo introduce herself and the other student chair.
Everyone, I'm Yolanda Yan. I am a PhD candidate at UNC Chapel Hill studying clinical psych, and I am luckily working with Kathryn and Ashley as the student chair. And again, for the people just joined us, if you're not yet a member on our email list, feel free to email us at this email address to get on our list.
Yes, and before I turn it over to Yo-Yo to introduce our session really briefly, I just wanted to say that, the Health Equity SIG is brand new. I think it's kind of a cool opportunity for folks who are interested in a leadership position to really shape it into what they want to be. And you don't have to have had super extensive leadership experience. So if you are interested, please feel free to, consider throwing your name in the ring. And Yo-Yo, I'll let you introduce folks.
Great, thank you. Well, welcome everyone again. So good seeing you. And thank you for joining us today for our Health Equity SIG panel. Today, we're getting together to talk about how we can keep pushing health equity work in digital mental health, especially given the challenging sociopolitical climate we're in nowadays. And I'm thrilled to introduce three incredible speakers we have today. They're Dr. Jacob Gordon, Dr. Andrew Berry, and William Liem. Welcome, and I'm going to pass to each of them to briefly introduce themselves as well as the work they do, and then we're going to open up for questions after hearing a little bit from them. Let's start with Dr. Gordon. Do you like to kick us off?
Sure, I'm gonna share my screen in a second here. All right, hopefully everyone can see that. Hi, everyone. I want to thank everyone for being here. I think it's a really cool SIG and a really important topic area. My name is Jacob Gordon. I am a pretty interdisciplinary social worker researcher, so I come from more the social behavioral side of things. I'm a new assistant professor at the University of Cincinnati College of Nursing. And once again, thanks for inviting me to talk with you all here. So we're going to be talking about designing digital well-being resources for LGBTQ plus youth. If I say queer, it's sort of an umbrella term, just because I stumble on that acronym all the time. So like I said, I'm a social work researcher that advocates for the the health equity of queer youth. And I really focus on translating basic research into the beginnings of interventions, whether they're digital interventions or digital resources. And I'm really focused on the topics of social media use, particularly dating apps, mental health, sexual health. And if you want to use the little chat function, I always like to poll the room. So if you don't mind putting the first word you think of when you think of the relationship between social media use and mental health of youth. I'm just kind of curious what folks think. And as you type that in and think a little bit, So social media, things like Instagram, TikTok, and dating apps have really transformed life as we know it, especially for the youth. And as we kind of consider what social media is, I always like to also say that I think dating apps belong in that group of what social media is. I always say that there's nothing more pro-social than dating and having sex. So I feel like it fits really well in there. And also that Facebook, one of the first kind of traditional forms of social media, its beginnings was actually like a dating related social media profile. So I like to kind of put that little caveat in there. And also sort of the timeliness of this research is that the APA, the American Psychological Association, has put out its first ever health advisory around adolescents' use of social media and their mental health. So it's pretty like from a sociopolitical standpoint, a really kind of timely area of research. So we know that some states are banning social media for youth. We know that there's risk and benefits with social media. And despite all these known risks, there's really no best standards or best practices for youth as they kind of use this technology. All right. So my perspective towards this work is intersectional. And it's really intersectional because anyone can be a dating app user and their identities play a huge role on their health outcomes. So the research I do is really understanding how particular identities sometimes will show up in these mental health disparities that queer youth are experiencing. So the differences between like a white queer man and like a Black trans woman are very different, and their experiences online are very different. Additionally, having a human-centered design approach, because at the end of the day, any resource or digital tool has to be acceptable and has to be usable by that population, whether, like I said, whether it's a different race, ethnicity, gender identity, or sexual orientation. And then sort of my main approach is really community engaged and youth centered. Ideally, at the end of this work, whatever is translated is it has to be from the youth themselves. They're the ones with the burden of mental health, and they're the ones that are going to push us through and get us the resources that they need. So it's really working collaboratively with the youth themselves and sort of giving them the tools to build what they need. All right. So I really envision a world where the changing technology, especially social technology, is not a threat to our queer youth's well-being, but rather a resource and a strength. So it's really, my focus is understanding how do we leverage the benefits and avoid the negatives. And so despite these federal level warnings around social media bans and conservative states banning social media, it might do more harm than good for queer people who depend on them for connection, for finding their community, and other things like that. So my work really aims at developing digital interventions so they can leverage the positive. I really consider myself a radical believer in social media and its amazing source of communication, or sorry, amazing source of connection. But how do we as researchers and practitioners prepare our communities to be savvy users of social media? And if I can ever get to here we go. So this is really kind of how I visualize the work that I do, and sort of the framework that I take in my approach is my research participants become partners and drivers in the research and the design and the implementation. So this means we have to include education, educators, experts, youth. We have to kind of put them in a room where they can have this like really brainstorming with divergent, convergent thinking. And then ideally we're creating resources that, are usable and acceptable. And I will say the caveat of this kind of talk is what I've learned is this research is highly political. And I think as academia, we haven't done ourselves service by kind of avoiding the policy sphere of the way that policy not only impacts our end users or people that we're building interventions for, but how do our interventions and resources fit the political context that we're, trying to implement them in. So my work has really in the last year shifted a lot and being how can we get policymakers in the same collaborative space, and how do we make sure that our research is also having political and like policy recommendations and implications. So that's my quick little blurb, but thank you all for listening. I'm happy to take questions at the towards the end, but I'm excited to hear the other speakers too.
Thank you so much, Dr. Gordon. If there's any clarifying questions, feel free to pop them in chat, and one of us will try our best to answer that. But if you have any other questions, feel free to hold to the end where we're gonna have open up the floor, the Q&A section. Dr. Berry, take it away.
Hi, everyone. Thank you so much for having me. I'm excited for this conversation. My name is Andrew Berry. I'm an assistant professor in medical social sciences in Feinberg School of Medicine at Northwestern. I have a PhD in human-centered design and engineering, and have also gotten some training in biomedical informatics and spent some time working at Epic. So for a long time, I've been thinking through how to design and implement technologies in the healthcare space with a focus on user experience and improving health outcomes that are meaningful to people. There are two questions that animate a lot of my research. The first is, how can we design healthcare services to be more responsive to people's values, identities, and capacities? And that word responsive, I'm kind of pointing back to the feminist care ethics literature. I think responsiveness is an important design ideal when creating digital health tools. Second question is, how can our research methods mobilize perspectives and the expertise needed to promote health equity and justice? In a lot of projects I work on, I serve a role sort of as a team scientist providing human-centered design methods expertise. I think a lot of you are probably familiar with human-centered design, so I won't spend a lot of time on this, but it's an iterative, collaborative process where we engage constituents directly in the process of designing things like technologies, services, and so on. Often when I give talks, I talk about incorporating patients' values into conversations with clinicians. Actually today I'm going to focus on some research coming out of this really exciting disability and health services work group at Northwestern. So this group is led by Dr. Carol Haywood, who was one of the founding members. We formed only about 2 years ago, but in that short time, we've submitted a lot of grants in different configurations of our members, and we're starting to get some funding for this work. So I'll share 2 projects that have come out of this work. The group includes faculty and trainees from Northwestern, as well as Shirley Ryan Ability Lab and Lurie Children's Hospital. The first project is creating a method for documenting disability status and meeting accommodation needs before primary care visits. Federal legislation mandates that healthcare organizations have to accommodate people with disabilities, but in practice, this does not happen. And part of the problem is that there's not a streamlined and standard way to document people's disability status and accommodation needs. So in this project, we're thinking through how to do that. So we're engaged in a series of 10 or more design workshops, engaging an advisory board of people with disabilities, and alternating between design workshops and iterations on the design within our team. And later on, we're going to test the tool that we build, actually build it into Epic and test it in a primary care clinic. So to give you a sense of what we're working toward, imagine you're checking in for a primary care visit. You may see, among the various questionnaires they ask you to fill out, you'll have the option to fill out a disability screening questionnaire. So if you select yes, I need additional assistance or accommodation, you'll then see a list of options. So we're asking both about disability status on the left and then accommodation needs on the right. Those don't always map one-to-one. People may prefer not to disclose some things, that may prefer not to request particular accommodations, but the options for both will be here. And then depending on people's responses, that gets shared with their primary care team. And then on the back end, our team is working with clinics to design the workflows to make sure that when someone declares a disability or an accommodation need, the clinic can actually meet those needs. So that's the first project. We're still very early in that work. And then this is another project that has just started. The principal investigator on this project is Heather Risser. So again, I'm a co-investigator, just like the last one, providing human-centered design methods expertise. In this project, we're adapting Mothers and Babies for parents of kids with Down syndrome. So Mothers and Babies is an evidence-based intervention delivered across 9 sessions for parenting people, pregnant and parenting people. It helps manage stress. So research shows that when parents are able to better manage their stress, they have better outcomes for themselves, as well as better developmental outcomes for their kids. But parents of kids with Down syndrome have unique experiences and concerns, unique communities that they're plugging into. So we want to make sure that Mothers and Babies is tailored to that community. So I'm just trying to show you. So there's a few different worksheets, for example, that we might tailor. So we're going to be engaging an advisory board of parents who have children with Down syndrome to look through worksheets like this across all 9 sessions and adapt the contents to make sure that it's appropriate and useful to these parents. So what are the specific helpful thoughts and unhelpful thoughts for parents of kids with Down syndrome? What are some tailored ways to think about goals for the baby's future, and so on. So again, just similar to the disability accommodations questionnaire, we're alternating between some work with parent participants, design work within our team, and then co-design with parent advisory board. So I'll just close with some parting thoughts on theory and methods at work in all of my research. So I'm combining on the left human-centered design, and I often think about that in terms of creating hybrid spaces where different forms of necessary and complementary expertise can come together to create something greater than the sum of its parts, and working to ensure meaningful participation from constituents in those engagements. And then on the right, recognizing that good intentions are not enough. So that term comes from a great paper by Tiffany Vino and others, identifying intervention-generated inequality. So it's not enough to want to address inequalities. We have to work that into our research practice and praxis, and recognize that digital interventions, for example, have the potential to exacerbate inequality. So we have to pay attention to that. So if you want to talk more, please reach out, and thank you for listening.
Thank you so much, Dr. Berry. Will?
Alrighty, perfect.
Thank
Well,
you.
all right, hi everyone. My name is Will Liem, and I'm a PhD student at Northwestern. And today I'll be talking a bit about my dissertation work, which is focused on co-designing AI tools for sexual orientation, gender identity navigation with queer teens. But to start things off, I'd like to talk a little bit more about the motivation behind this project. So in the US, there's a strong lack of queer inclusive sex ed, where 72% of queer specific topics are actually completely omitted. So as a result, a lot of queer teens are left to navigate questions about their gender and sexuality without structured support. And in the absence of affirming adults or curricula, many are turning to the internet, which can be precarious given that they're tasked with this challenge of needing to sift through mounds of information without any sort of guidance. And something that we're seeing is that marginalized teens, and especially queer teens, are increasingly using AI chatbots to ask anonymous questions about very personal matters, since they're looking for non-judgmental spaces, and also sometimes they might just not have someone that they could talk to about these personal questions. But these tools weren't designed with queer teens in mind. Most AI models are trained on cisnormative and heteronormative data, which means they can misgender, pathologize, and even erase the very people that are seeking support. So even though these tools can offer comfort, they can also reinforce the same harms that push teens away from the traditional systems in the first place. So I asked myself, what if we flip that script? What if we design AI tools for queer teens by queer teens? And that's what my work is about, co-designing AI tools responsibly that can hopefully reflect teens' lived realities, values, and needs. Similar to Jake, I'm also trained in social work, and I see social work as the art and science of human relationships. Not just between people, but also between people and the systems that shape their lives, which include technology. I focus on how queer teens relate to AI, not just as users, but also as people seeking identity, care, and safety in digital systems shaped by bias. And it's not just about making AI more accurate, but more about how do we build it with care, how do we confront power, and how do we create space for teens to shape the tools that they use to understand themselves. And given that this SIG is about health equity, I feel like this is an example of what digital health equity can demand. Not just access, but alignment, affirmation, and agency, and a deep commitment to designing from the margins. And so how do we do this work? Well, my project unfolds in 3 main phases, which I'll give a high-level overview of how I'm doing it. Phase 1 is where we're currently at, where it's exploring how queer teens explore questions around their sexual orientation, gender identity. What digital tools do they currently find helpful or harmful in that process? And I'm especially interested in the role of what AI might play. When is it appropriate? When is it not? And so we're engaging a really cool group of queer teens through our Youth Advisory Council, where we're engaging on a private Discord server and we run polls and threaded discussions. And in the coming month, we'll be conducting speculative design workshops and one-on-one interviews to hopefully surface some of these expectations, concerns, and hopes around how AI-based tools can support identity exploration. Then phase 2 is where we get into the crux of it all, where we're actually going to be collaboratively building the tool itself. Our teams will actually be helping curating the data set, vetting whether the content is teen appropriate and relevant, and they'll also contribute to the original content that gets used in fine-tuning the model so that it can actually respond in teen language. Beyond that, they'll also participate in usability testing to evaluate what feels firming, safe, and useful. And then finally, in phase 3, because these participants will be engaging with us throughout the entire process, we'll synthesize their learnings into an AI literacy toolkit, which will live alongside the chatbot on top of our lab's website. We see teens as not just participants, but also as AI designers in their own right. And this final toolkit will hopefully reflect their lived expertise, which can offer tips and insights for navigating not only this specific AI chatbot, but hopefully other AI chatbots that they might engage with in the future. But for today, I'll just be focusing on some of the preliminary findings from phase 1. And so when I first started this project, I saw responsible AI as mostly a technical problem, something to be solved by reducing bias in a model. But working alongside these teams, that quickly expanded my view of that. What became clear is that responsible AI isn't just about optimizing models or reducing bias. It's about building a system that helps teens decide when, why, and whether to use AI tools to begin with. We hear from our teens that they're very concerned about the environmental costs of calling AI models, but it can also be an incredibly helpful tool when they're wrestling with a lot of questions about their identity and they have no one to go to. And so as part of my commitment to listening to our teens, we're trying to meet them where they are and figure out how might we empower them to navigate AI on their own terms with clarity, trust, and choice. And so while I haven't conducted the co-design workshops just yet, I'm using the early insights from our Youth Advisory Council to imagine what direction we might go towards. And what emerged is what I call kind of like a hybrid approach, one that recognizes that not everything needs to be powered by AI or solved by AI. In fact, a lot of our teens who have used a chatbot in the past to explore questions about sexual orientation, gender identity have felt that the responses can be generic or redundant, like something they could have just Googled. But when they had very specific questions, it can be really helpful to kind of elucidate some of these more murky questions and get some emotional comfort from it. And so we can think of this proposed solution as a system that would live on a web page hosted by our lab and includes 3 interconnected layers. The first layer is FAQ content. So you can think of this as static teen-authored responses to common questions around sexual orientation, gender identity. This is kind of like a lightweight, low-risk first step that avoids unnecessary AI use and avoiding that environmental costs and privacy concerns that some of our teens have mentioned. It can also include curated links to trusted resources that are vetted and selected by our queer youth as well. And if that static FAQ content isn't sufficient, we direct them into the next layer, which is an AI literacy guide. This piece supports teens in critically engaging with the chatbot if they choose to go further. And it provides practical tools for discerning when to use AI, how to prompt effectively, and how to identify hallucinations or bias response. The goal, again, isn't just access, it's about agency. And this guide will directly be shaped by the YAC's reflections and testing. And finally, at the core, there's the AI chatbot itself. It'll be fine-tuned by our participants' original content and also by vetted data sources. And we're thinking of this being very transparent by being very clearly communicating what data sets it was trained on, what it can and cannot do, and where its boundaries lie. Ultimately, this system offers more than just answers. It can hopefully give teens the tools to decide how, when, and whether they want to engage with AI. And to me, that could be an example of what health equity can look like in digital design, not just building tech for teens, but also with teens in ways that redistribute power and promote care. And so if folks want to continue talking, I have my information here and I look forward to your questions. Thank you.
Thank you so much for all three amazing speakers. I'm learning so much, and it sounds like even though you are all working at different spaces, you really are making sure to engage marginalized population and make sure the inclusivity and the impact of your work. So why don't we open up among you, the three of you, as you hear each other's work. I wonder if you have any reflection or thoughts just by hearing each other's work.
I think we all spoke in one way or another about meaningful participation in this research. And I'm curious for either of you, how do you know that participation is meaningful? What are some signs that it's working well?
I think for myself, it's you're giving them something in return. Like, you're getting data and you're like, hopefully you're building interventions for them, but hopefully they leave a work kind of like, when you're doing a workshop that like they're leaving with a skill themselves. Like whether it's like in Will's example, like maybe they're leaving this research with a better idea of like how and when to use AI as a participant. And I think giving them that kind of inside view of the research process, I always think of like, what am I giving back for participants? And it's something that's actually like tangible, not just like it was a good experience or yeah.
Yeah, I think like a small example of something that happened recently. So in the last couple of weeks, we've had a series of discussion questions, and members from our lab would often kind of like follow up with either probing questions or to kind of just like follow up on their responses. And some things that I really enjoy seeing is when people react with like capital yes and exclamation point, and just kind of like affirming that like their perspectives and voices are heard, and that it's almost kind of like a process of member checking as well. It's like, I'm hearing this. Is this what you mean? Can you elaborate a bit more? And I think having that kind of like continuous dialogue is quite nice instead of just having it be like, here's like a one-on-one interview. Thank you for your information. We're going to head out. I kind of really enjoy having this like Discord server platform so that we can like continue these like engagements, not just at one point.
Right on. Yeah, one thing I also heard in your work, Will, is like you had an idea about what you were designing, and then based on what you heard from participants, you changed course. That to me is also a sign of meaningful participation, that you're not specifying for them what the direction that the project will go. And I've had some very humbling meetings with parent advisory boards recently where like we really needed to hear how wrong we were about a few things. And so, yeah, it's just, I think that's a clue for me too, like when you hear you're wrong.
Yeah, I think that was an interesting question about, how do you know what meaningful participation is? And, what I'm hearing is it's a sort of bi-directional like exchange. And, I'm wondering if anybody sort of encountered resistance or pushback to this idea. Just, from my own experience, I was trained in this program that was it was like very top down. Researcher sort of like always knows, or the person who's designing something, whether it's an intervention or a study or what have you, always kind of knows the best. And it took a very long time for me to kind of undo that for myself in the work that I do. So I'm just curious, like if any of you have encountered, like, why would you do that? Like that slows down the process, all of that stuff. And how did you deal with it?
I don't know if I could share how I dealt with it, but it all dawned on me when I think Dr. Newcomb had this experience at this gym, but I aged out of my population that I study. And that was such an eye-opening of like, oh my gosh, they know more than I do. And like, because social media and dating apps change so quickly as far as like the content, like what people are doing on them. And when I used them, 10 years ago, it was so different. And it changes so rapidly. And I realized like, oh yeah, like I study young adults. I'm not really a young adult anymore. And I think just having that realization really put me in that seat of like, I need to listen to them and they know more. And kind of like Will being able to change on the fly. And yeah, that made me think of that though, like getting older.
Cool. Did I know that there was a question in the chat for Will that Will responded to, but I didn't know, Heather, if you wanted to elaborate or say a little bit more about what you're thinking.
Yeah, since part of this whole process of fine-tuning a model to meet a specific, I guess, like purpose, it requires very intentional questions of, like what is it designed for? How do we get the specific data sources for it? And I think part of the challenge is like, what are all these like specific use cases that we're gonna be kind of like designing for? One of the ideas that I had was to have the teams come up with a list of questions that they think would be really important to ask these chatbots. And also, when we have the list of questions, we'll also then try to find sites and sources on the internet to see like, hey, are there specific sources that you think would be really helpful in answering these questions? And if so, what about it? And that will start to generate kind of like the list of trusted data sources that we'll use to fine tune that model. Oftentimes when we think of like building an AI model to like reduce bias, but I think in many ways I am building more bias into this tool because it's meant to be for teens. And so I think that's like a tension that I continuously like see in my work. It's not just about reducing bias, but making it fairer for the people we're designing for.
Thanks, Will. I think I had one question about constraints. I think that I was also hearing about how there are kind of various constraints in the research process, in the funding sources, in your timeframes for doing like dissertation research or like early career faculty or, working in a medical school or whatever that, I think could potentially threaten people's ability to do this like kind of slower process of community building and really hearing from people. And I'm, like, given that this is a pretty like mixed audience of people from kind of across the spectrum of like students, professionals, industry, et cetera, like what are your strategies for kind of navigating those tensions that like, you recognize that there are these constraints, but you're trying to do the best you can? Like, what is an example of that from your own work? And I can start with an example from mine if that helps seed people. So I don't know if that question was super clear, but I think when I think of building, equity into the work that I do, I try to think of it from sort of like the bottom up. And I think in the past, I would have maybe hired, the person who was most easily available, who we'd worked with before, who was like an expert in their field to like design something. And then when I think I started doing more digital health work with teens, I was realizing they have a lot of their own ideas about stuff. A lot of them are creative in their own right and have a lot of ideas about how the technology that we can make for them can be better. And so I think when I realized that was during a focus group where I was just like, why don't we just ask them what they think this thing should look like instead of us bringing the data to like, a professional like UX designer and being like, can you make something out of this? And I think it was then where I was like, oh, we can rely on the people that we talked, like they don't just have to be research participants. I think that like Will might have alluded to this, like they can also be the people who help us design it. And maybe they don't have like the technical skills to like develop this website from the ground up, but they can work with the web developer. So part of it was like, how do we pay teens for their own expertise while like and finding a developer who was willing to iteratively work with the teenagers and have like the humility to be like, I'm not going to be offended if these teenagers don't like what I do, and kind of like work with them to make sure that their perspectives and insights were like realized in the ultimate product. So I was just wondering like, and whereas before I would have just like distilled the research ideas into like my own language and turned it over to, a designer, and like it would have been sort of all adults mediating the process instead of adolescents. I do adolescent research. So hopefully that clarified.
Yeah, I just want to acknowledge that there are many constraints on this kind of work. They're very real. And I think I had a hard time coming up with an answer because I didn't want to give a very kind of pessimistic and like response and agreement. It's hard to do this work, especially now. I think one thing that I challenge myself to do, and that I'm successful at only a little bit of the time, is leaving space for that deeper relationship building work and for that kind of opportunistic, just showing up in spaces where collaborations could form, and leaving space for rest. Like to me, navigating the very real constraints, sometimes you can't change them. Like I can't change that I'm working in a soft money position, without making pretty big changes to my life. I can't change that funding priorities are shifting, but I can leave enough space in the day to visit a new potential community partner at their place of work, outside of the university. I can leave space to try to rest and recharge. So the next day I'm ready to go at, knock my head against the constraints one more time. So that's where my mind went, like both, oh, this is a scary question because I don't think I have answers. And also, here's what I'm trying to do, even if I'm not always successful at it.
Appreciate that. Anybody else want to answer before I turn it over to Emma?
Yeah, I think so before I returned to grad school, I was working in industry and in consulting around fairness and algorithms and community-centered approaches to it. And something that I quickly saw was that queer fairness was largely absent from a lot of the conversations about responsible AI. And so part of the reason that I returned to grad school was that I realized that in order for this work to be taken seriously, I needed to build that research agenda for myself to create the evidence base, the frameworks, and the language that make queer fairness legible to institutions that otherwise wouldn't care. And so in some senses, it's kind of like about like creating like the academic and ethical currency, if you will, needed to like push these conversations into spaces that's been ignored. Yeah, I think it's like for me, it's if a company like because I'm thinking of like returning to industry, it's really about kind of like building that like credibility and also like that's the evidence that shows like there's a sense of urgency here. And that's kind of like how one of the ways that I'm trying to like push the dial.
Thank you. Emma.
Hi, thank you so much for your talks. Hopefully you can hear me. Hi. Yeah, thank you so much for your talks. I really enjoyed them. I have to say, like, this area of research is kind of one of the things that gives me the most joy. So yeah, I really enjoyed hearing the work you're doing. So I'm a postdoc. I'm based at University of Virginia, but I moved to the US August last year. So previously, all of my research experience, and I had quite an extensive amount of doing patient public involvement, as we call it over there, in this kind of sphere. And I'm just really trying to kind of familiarize and learn about the different ways that things are conceptualized in the policy land, sort of the way that's kind of this work is done over here compared with the UK. And I was just wondering, actually, if you, based on your experience, like, and expertise in this area, like, do you have any particular kind of resources, like the signposting for like policy guides? I know the UK landscape pretty well. They do some really like interesting kind of work in this area. We've got guidelines and sort of the involvement of patients and carers in sort of grants is required for a lot of the big grants in the UK. I'm just wondering if you have similar kind of websites, equivalents for this kind of thing. And yeah, I was working on a grant recently, just kind of doing some of the background research and just trying to get the language right as well, because I know there's lots of different ways to say the sort of work that we're doing. So yeah, might not be something you know off the top of your head, but I know Picori is out there. That's kind of one of the ones I know the most. But yeah, thank you if you have any suggestions.
I can at least put in the chat the full citations of the two chunks of like theory and methods I draw on a lot. So some of that comes from a great book chapter on participatory design as the third space in HCI. That's where the hybrid spaces kind of theorizing of co-design comes from for me. And then on the kind of digital health equity side, the first place I look is Tiffany Vino. I think she's an incredible leader in this space and has published a series of papers over the last 5 to 10 years that build a really strong argument for why we need to pay attention to equity and like health informatics, how to do so, and so on. So I'll put some links in the chat.
Thank you. I actually had a follow-up question as well, but I don't know if that's being cheeky.
Go ahead.
It was whether like the particular sort of community engaged research and participatory sort of frameworks or models that you follow. If yeah, it's kind of linked to what you were saying just now, Dr. Berry, but yeah. Again, just kind of curious to know if there are particular approaches. I know you said a couple of you said that your models, your work is kind of informed by social work as well.
I think one thing to your question, also the question that Kathryn asked last, was it's harder to do. So like at HCI, like especially health equity, digital health equity, there's this idea of like design for the margins first. And all three of us, the speakers talked about working with marginalized populations and that sort of like, working with sort of the most marginalized first, and then maybe like backtracking and designing outwards. It's harder to do that now in this political landscape. And I think that's one of the struggles where it's like, whether you work with like the LGBTQ plus community or the, disability community, like it's harder to do that work because it's politicized. Even the word, equitable or inequitable is, at least in the state of Ohio, like an outlawed word. So just putting that, like, I feel like those approaches or those perspectives of like participatory research or designing for the margins, they're gonna have to change in the context of what we're dealing with now, I think. That wasn't an answer, but more of a complaint, actually.
Okay, this is also space for complaints. Yeah, I mean, I think, I think that the papers that Andrew's putting in are great. And I also, recognize that some of the things that, some of the terms, like Jake said, that we use to talk about health equity and, inclusion are things that if you're looking at sort of federal sources of funding or positions or what have you, are sort of things that we have to kind of talk around now. And that, to get back to all the constraints that we have on the work that we're doing. But, I think one way that you can still do this work, in the spirit of like health equity and inclusion, while, on the surface, like not using all of those words is, at the end of the day, like we're trying to design stuff that is that's for everyone, not for everyone like watered down, but like really intentionally, like really is for everyone. And I think that in some of the proposals that like the group that I work with has written recently, we're really thinking about like okay, so the royal they like wants us to sort of make, not call out a particular population in the projects that we do or what have you. So how can we kind of turn this back around and be like, okay, how do we really make it for all? Like how do we, use that language and really like make it into like reclaim it, you know what I mean? So you might be using a lot of the principles from, some of the things that Andrew is talking about, but if you're like trying to get funding from a funder who is, trying to align with federal priorities, like, thinking about how to thread the needle is something that I know that our team is actively, trying to dance around.
Yeah, I mean, I'll jump in on that a little bit. I think one of the questions that animates my research is how can we design healthcare so that it's more responsive to people's values? Like everybody has values, and our values link to different communities. But if we start with what matters to you, what's important to you, and design from there, it doesn't preclude focusing on specific populations when we want to and when we think it's important. And it potentially, yeah, creates the grounds for the health for all approach that it seems like we need to align with for now.
Yeah, I think related to that, one question that we had for you all is to almost like an advice giving thing. I know, Andrew, you talked a lot about values, so there are a lot of early career folks, I think part of SDMH grad students, what advice, or grad students who are like, before Will's, before where Will is in their career, what advice would you guys have for finding or trying to build projects that really are values driven in a time like this? And any suggestions for people who work in spaces where they really might have to fight for doing work that is more equity and values driven, or who might be concerned that like it's sort of a non-starter to focus on equity at this time.
Just pausing in case others want to jump in. No.
Or like, what advice would you would you have given a younger version of yourself?
I think I spent a lot of time early in my research career just being worried about satisfying certain standards that were sort of externally specified, like standards for rigorous research, standards for what makes research exciting and cool, etc. And I think where I've really found a home finally is research that's personally meaningful to me. I don't think you can ever go wrong like continuing to engage with your communities, people that share your identities, and learn from them, partner with them in your work. That doesn't necessarily get around like the hard constraint on naming particular populations in federal grant proposals, but I think you can't go wrong kind of continually reflecting on who you are and what communities that connects you to. So to be more specific, like I have a 4-year-old son now who is very medically complex and has developmental disabilities. And it's opened a whole world of care and interest for me. I feel like there's just like countless collaborations blossoming just around that personal interest. So that would be my advice. Like, don't be afraid to follow your identities and your heart and your communities.
Thanks, Andrew. Cosign. Jake or Will?
I think for me, for other grad students, and I guess like if I were to talk to myself like a couple of years back, is to really see grad school as kind of like a creative playground, and it's like a really cool time to not just explore your own ideas, but also explore other ideas as well. As someone being based in like a school of medicine, a lot of the funding opportunities that came by were primarily through like NIH grants, and something that I really valued was like talking to other people who weren't in the medical space. And that's how I got exposed to different funding opportunities. And I was thankful enough to be able to get a grant from a foundation. I was initially planning on submitting an NIH F31 fellowship, but I'm pretty glad I didn't because it would have been automatically a desk reject with this new administration. But the point is, I think it's really important to start networking early on, not just within your communities, but outside of your communities, because I think there's a lot of appetite for more interdisciplinary work. It's just a matter of like, how do we actually do this and where do we do it? I found a lot of success in just like cold emailing people, attending different conferences, going to different talks, and you'd be surprised at like who'd be interested in the type of work that you're doing. And it's just really cool to like get to share ideas with others.
Yeah, I echo both what Will and Andrew are mentioning, and also just being open to new experiences and being in a community engaged research means more than from a methodology standpoint. It means like showing up in spaces. And I think if you show up in those spaces, opportunities will rise, whether it's like a formal academic NIH grant or something like community level research. It's the same value driven, so it'll give you, a sense of worth, but there's other ways of doing research, even if a particular funding agency says you can't. Yeah.
Thank you so much. I'm looking at the time and realize that this ends in just about a minute. So does anybody have any last questions or comments for our panelists today? Or maybe our panelists can end on like one really quick thing they're feeling optimistic or excited about in this space.
Yeah, what might be a next step that you're most looking forward to now that we've learned a little bit about your projects?
I'm excited to keep thinking through how to do human-centered design well within, like a classic NIH-funded research project. I still think there's a lot of unknowns about how to do this well and a lot of interest in doing it well. So I invite you all to join me in kind of charting that future.
I think for me, the chatbot's cool and all, but I'm really excited to see like what the teens say about like how to engage with it, when to engage with it, and like when is like not advisable to use it. I'm really keen on seeing kind of like what are the boundaries of AI when it comes to sexual orientation, gender identity navigation from a queer teens perspective. So very excited for that.
In the dating app social media world, there's a lot of dissatisfaction around dating apps. And one thing I've been really looking forward to exploring more is sort of what is an alternative to dating apps for like the queer community, and what's it mean to be like offline in modern context.
Awesome reflections. Well, thank you all so much for your insights and your attendance. And for folks in the chat, please feel free to reach out to our presenters if you want to connect. And thanks for attending the Health Equity SIG meeting. Bye, everyone.